Every 11th Indian is formally diagnosed with diabetes, and undiagnosed burden is separate. Every sixth diabetic person is an Indian. So this sounds grave.
Now, diabetes is a burden, assuming dangerous proportions, increasing by the day. And we are virtually on a time bomb waiting to explode any moment. From pre diabetes, it is absolutely possible to go back to normal sugar state, which is called the normal glucose tolerance. I have two medicines, as it were. One is diet control, one is exercise. These are the toughest medicines to take. Obesity is the major driver these days for this emerging pandemic. Putting on weight or after getting diabetes, sugar control is basically a game of calories. Yeah. So 1 gram of carbohydrate, 4 calories, and fat, 9 calories, 1 gram. So you can imagine which is more detrimental. We tell our patients that diabetes is your companion. So love your sugar levels and you shall be fine.
Ladies and gentlemen, welcome to the new insightful episode of Tata 1mg podcast series. Here we dive into health and wellness space along with an expert so as to help you lead a healthy and happier life. I'm your host, Dr. Prashant Nag, and today we will embark on a journey of crucial topic of diabetes and its management. Today we have a renowned expert, Dr. Dheeraj Kapoor. He's a DM endocrinologist, presently working as Chief of Endocrinology Department, Artemis Hospital, Gurugram.
Thanks, Dr. Kapoor, for being part of our podcast on diabetes. As we know, the diabetes is a big problem. What we are reading around is that every 11th Indian is formally diagnosed with diabetes, and undiagnosed burden is separate. Every sixth diabetic person is an Indian. So this sounds grave. So how do you feel about diabetes incidence in India? Is it increasing? How is it going? So just your views.
Now, diabetes is a burden, assuming dangerous proportions, increasing by the day. And we are virtually on a time bomb waiting to explode any moment. So diabetes has increased phenomenally over the past 10 years.
So we are talking of time bombs. So we'll go deep on it. What is taking it off? Is it lifestyle? Is it urbanization? Or is it ethnicity which is pushing us? But before going deep, we'd like to know about what is diabetes when we talk about in medical terms, and say a phrase, "Mujhe sugar ho gaya hai, I'm suffering from sugar." How synonymous it is? We'd like to know about that.
So first of all, diabetes is not a new disease. Described way back in the BCs. And diabetes means to pass through. So evidently, the patients were passing excessive urine. That's where that term came from. Now, the common parlance, "mujhe sugar ho gaya hai," means that I have high levels of blood sugars. As regards a synonym, yes, in the practical term for a common man, it is synonymous. But as we delve deeper, diabetes actually means managing blood sugars, your blood pressure, and cholesterol, because they are common factors which run along with deranged sugars.
Okay, so we are talking of a state where body is having high sugar. A reason behind it is something which is we need to know more. So let's try to understand what are different types of diabetes. If you can put some light on types of diabetes.
So first of all, diabetes is a hormone-based disease, and insulin is the hormone. So very common in a mathematical way. Let's explain. Either insulin is not being produced, or it can't act, or both. So type 1 diabetes, wherein insulin is virtually negligible in the body, the patient needs to be on insulin lifelong for sugar control and for survival also. Type 2 diabetes, it is being produced, however, it is not sufficient. So these are the patients who can do well on tablets. There are many varieties, but one more, that is GDM, Gestational Diabetes Mellitus, which happens in the pregnant woman diagnosed for the first time in pregnancy. So that is GDM. It disappears generally after delivery, but still 40% of these women go on to become permanent type 2 diabetes patients.
Just explaining to users, so insulin is a hormone which is secreted by our our pancreas. So you're talking of there can be a condition where pancreas are unable to produce, and there can be a condition when body is unable to use the produced insulin.
Absolutely.
So level of insulins in the both cases will be different, where you will have a lower levels in type 1 diabetes. In type 2 diabetes, you may have a normal and even a higher level of insulin.
Yes.
Got it. So going forward, we have heard that type 1 diabetes is a disease of young, type 2 diabetes an older age group. So how do you feel that is age discrimination of types of diabetes work?
So if we were doing this 10 years earlier, maybe 15 years earlier, yes, young type 1 diabetes, the elderly type 2. Now, the reason was that in the young type 1, because body did not make insulin. In the elderly, body made but could not act. Now, because of the pathetic, I'm sorry for the word pathetic, but the pathetic lifestyle of these kids, all work and no play, then foods of all varieties, no exercise, they are putting on weight. And therefore, they are becoming insulin resistant. So we are seeing type 2 diabetes in children also. So as of now, age as a bar or discrimination for type 1 or type 2 does not exist in my mind.
As we're talking right now about we are diagnosing diabetes, but there is a term which is commonly used is pre-diabetes. So if we can explain it out that how pre-diabetes is it reversible? What precautions one can take to see that pre-diabetes does not go to diabetes? Should it be managed by drugs? So just it will be great help if you can explain that.
So first of all, we know what is diabetes. Fasting sugars, 126 or more. After food or after glucose challenge, 200 or more. Normal sugar, below 100 and in fasting, and after food or challenge, less than 140. Now, this gray zone between 126 and below 200, 140 is pre-diabetes. However, this term meant that ab diabetes ho hi jayegi, which is not correct. So now it is called at risk for diabetes. Now, why this discrimination? Because people with pre-diabetes, the so-called pre-diabetes, have a common risk factor as diabetes for heart disease. The risk is same. That is why this was coined. And other important factor is that from pre-diabetes, it is absolutely possible to go back to normal sugar state, which is called the normal glucose tolerance. Now, for that, I have two medicines, as it were. One is diet control, one is exercise. Simpler said than done. These are the toughest medicines to take.
With this urban lifestyle, when you're running from pillar to post, your time is not in your hand. I can totally relate to it. So, as Dr. Kapoor, you mentioned about the level of sugars for diagnosing of diabetes, and we know that it is the blood sugar level which are indicator of that we are developing diabetes. Let's try to understand. We talk of screening tests, we talk of diagnostic tests of diabetes, and is only the test the way, or what are the symptoms on which patient should think that they should get tested for sugar or say see a doctor for diabetes?
First of all, testing is the best possible way. I'll tell you what, 60% of diabetic patients do not have symptoms. Would you believe it? So the typical polyuria, excess urine, polydipsia, excess thirst, polyphagia, excess hunger, weight loss. 60% people don't have it. So screening is good. Now, as regards diagnosis, the gold standard is fasting sugars and glucose load. This is not possible in general public. So screening test, which may be done by a fasting sugar or a random sugar, can be done. That is more practical. Agreed, it may miss a few cases of diabetes, but then it is more practical than the complete glucose profile after the glucose challenge or glucose load.
You were talking of insulin earlier. Do you feel that is it a part of a screening test or it's a diagnostic test? What is the role of doing insulin in diabetes patients?
So first of all, to my mind, not much of a role. As you said yourself, that in type 2 diabetes, insulin may be higher than the normal range. So that would send a false hope to the patient that I don't have diabetes, which is not a fact. Because as I said, insulin cannot act in type 2 diabetes, right, properly. So levels may be higher. So to my mind, checking insulin is not of much relevance in patients with diabetes or who are being screened for diabetes. Yes, sometimes In pre-diabetes, if you check it and levels are high, that may actually make the patient more aware and more careful.
Okay.
That is the only logic. Otherwise, from the treatment standpoint, no benefit at all.
Going forward, I like to touch upon some myths over the conversation. We'll go deep on every part, but I'll be touching some myths. So we'll take few. We have heard that obesity is those who are obese are bound to get diabetes.
First of all, we must understand in medicine, there is nothing as 100%, nothing as 0%. But yes, obese people are more often than not going to get diabetes. So if one believes that we have to lose weight, it will only be beneficial. Of course, there are genetic factors, of course, but obesity is the major driver these days for this emerging pandemic.
You mentioned that there are some genetic factors. Can you put some light how genetic factors work in diabetes? And say if a sibling is diabetic or a parent is diabetic, how dangerous or how person has to be more careful in terms of getting diabetes?
Patients ask me, sir, does sugar run in families? So here's this patient on the heavier side. The husband is heavy, the mother is heavy, and the child is heavy. So I say the point is no one runs in your family.
Got it.
That is
So
why.
it's a lifestyle that
Yeah.
family is living.
Yeah, but nonetheless, genetics do play a role. And there, if the father has diabetes, there's a 30% chance of the child getting diabetes. If the mother has diabetes, the chance is even higher. And if both parents have diabetes, then 70% chance. But one must understand that 30% still don't have a chance. So let's stop blaming our genes. We can't change them, but we can at least change our lifestyle, and we can change our eating habits and exercise habits.
But what are your views on artificial sweeteners? Do they help to a person who is non-diabetic in getting in saving him from getting diabetes?
So sweeteners are like saccharin, and then aspartame, sucralose, and now stevia. Right? So they can be taken by the diabetic patient. I will not go into the details because it will be too much for the general public. But yes, they do alter the body metabolism, the body probiotic mechanism by which they can actually trigger diabetes in a non-diabetic person if they are overconsumed or overdone. So that can be a problem. But yes, one thing is for sure that they themselves don't increase the blood sugar levels in a diabetic patient.
Fair. So they can be of some help to a diabetic patient, but in non-diabetic, you don't feel there is a role out there. Just taking a cue out here, consuming more sugar cause diabetes.
Indirectly, yes.
So we are talking of more sugar means more extra energy, more fat, and that fat may lead to diabetes. But it is not just that the sugar goes into your body and which causes diabetes.
So I will tell you something, that putting on weight or after getting diabetes, sugar control is basically a game of calories.
Yeah.
So 1 gram of carbohydrate, 4 calories, and fat, 9 calories, 1 gram. So you can imagine which is more detrimental. But the fact is that all fried things are not sweet. And when we start eating them, we feel, nahi, mithai nahi kha rahe hain. No, it is possibly worse than eating sugars. So yes, you have to balance your calories. 50% of calories should come from carbohydrates, 20 from fat, and 30 from proteins. Some people say 20 protein, 30 fats, but whatever. Carbohydrates, and mind you, carbohydrates, chapati and barfi, for example, are not same. Barfi is simple carbohydrate. Chapati is a complex carbohydrate. So all this while, we were eating chapatis, no problem. Now we are eating junk, getting diabetes, and stopping chapatis. This is so hilarious. So no, we can't blame the old grains for that. It's basically the newer forms, the refined flour that we are eating, what we call maida in Hindi. That's the big problem.
Since you were talking about sugars, we all know that fruits are sweet. But fruits are not that bad. So we'll like your views on how eating fruit can be detrimental for our diabetics, and what is the proportion one can aim when it comes to fruits.
So I know with fruits, I'll be hitting the beehive here, and most people might not like what I'm saying. But these typical very sweet fruits, I'm not here to mention name, one is the king of fruits, they are best avoided. The reason is this, that each and every fruit is allowed in diabetes. Every fruit. But there has to be a limit. And therefore, once we start eating a particular fruit which is very sweet, we go overboard and cause a sugar spike. And that is the problem. So, fruit maybe 150 grams to 200 grams is good enough for diabetes. But we must understand that fruit should be a separate portion. So, for example, breakfast and fruit not together. Lunch or fruit not together. So, breakfast. In the interim between breakfast and lunch, have a bowl of fruit. Or if you want, lunch and dinner in the interim. But along with the major meal, if you eat fruit, the sugars will spike.
Fair.
So you can have fruit, no problem, but in the interim, not with the heavy meal.
Great to know. It's not that diabetics have to avoid fruits. It's just that they have to take a balanced diet, and that is the key. We do understand. By any means, you have to avoid the processed food. You have to take a balanced diet, and that becomes all the more essential when you have diabetes. So yes, going forward, uh, as diabetics are on drugs also, and I read a myth that people were talking about, that diabetes medicines affect kidneys in long term. So let's talk about diabetes, its medicines role in kidney damage, if any.
Okay, so when we were students, there were just two drugs which would increase the sugar level, or rather the insulin secretion, and of course the action. Now there are many drugs which will cause sugars to be normal but will not cause low sugars. Drugs do not cause kidney damage. This is very clear. The sugars are not controlled by the drugs, and it is the uncontrolled sugar which causes the kidney damage. Not, in fact, now we have drugs called gliflozins, SGLT2 inhibitors. They protect the kidney, leave us at kidney damage. So, no, to my mind, anti diabetic drugs don't damage the kidney.
When we were talking of diabetes, we talked about age, how it affects early. We talked about type 1 diabetes and all, but we didn't discuss how it affects different genders. So is there anything like propensity or the severity difference between both the genders, or the effects also in terms of complications also?
So, of course, it affects both genders by virtue of weight, lack of exercise. We Southeast Asians are more prone to diabetes as compared to the Western counterparts. And that is why possibly the Western guidelines of management might not hold that true in our subset. Coming to your point of genders, well, first of all, women. They are protected against cardiac disease by virtue of various hormones. I won't go there. But the moment they get diabetes, this advantage is lost. And of course, disease, cardiac, actually may be more severe in women. But on the whole, we Indians or Southeast Asians develop diabetes a decade earlier as compared to the Westerners, and also the cardiac disease we develop a decade earlier as compared to our Western counterparts. So, 3 points in here: diabetes earlier, heart disease earlier, women lose the advantage of the diabetes, and more severe in women, these complications.
So it's not about getting more diabetes, but it is about getting more complications, which makes uh, females say losing their protection of female hormones against the heart diseases when they suffer from diabetes. As we were talking about gender, you mentioned earlier about gestational diabetes, that is the diabetes which is occurring at the time of pregnancy and coming for that transient period and going after the pregnancy. We'd like to know more details around it, how one should approach it, and how it works for the patient.
See, Dr. Nag, first of all, look at the risk factors for gestational diabetes. Number one, someone who's on the heavier side. Number two, someone has a PCOS, and people know about PCOS, they are so aware these days. Family history of diabetes. So we know that who is at risk for GDM, and therefore, the management of pregnancy induced diabetes starts before pregnancy. So, before pregnancy, you must aim to lose weight, improve your dietary habits, and exercise. That is the basic. Now, why is GDM important? Type 1, type 2 is fine. Why GDM? Because two generations are at risk, the mother and the unborn child. So you can't ignore that. And the first trimester of pregnancy is the one where the baby's organs are being formed. So if the sugars are high, the baby's organs may be malformed and they may be a problem for the whole life. So that is why sugar needs to be checked regularly. Now, if someone conceives, is not a diabetic person, in India, in first trimester itself, we screen for diabetes. And the screening is sugars in fasting state and after glucose load. That is one. Second, with God's grace, everything is normal. Screen again in the second trimester. And if everything is normal again, then screen again in the third trimester. 26th to 28th week is the time frame where it is believed that the maximum chance of picking diabetes is there. But as I said, we are different people by genes, by our body habitus, fat at the wrong place, the belly fat or the visceral fat. Therefore, we need a more aggressive screening. Now, why does GDM develop? That connection, the placenta between the mother and the child, that produces anti-insulin hormones. The insulin can't act the way it should. And if the pancreas are borderline because of previous obesity or PCOS, then GDM develops in these children. Interestingly, in India, those conceiving after 25 years of age are prone. This is what my experience says. And obviously, don't take it verbatim, but yes. So there is EBM, the evidence-based medicine, and there is experience-based medicine. So EBM, both EBM. So therefore, 25 years and above need to be cautious about the impending GDM that they are having. Complications can happen both in the mother and the child.
What all sort of exercises you feel or activities you feel a diabetic person should do? And is it just about reducing weight when it comes to diabetes in terms of exercise, or is there anything more?
So first of all, how does exercise improve your sugars, right? Now what happens is, just a simple example, जितना मैं खाता हूँ दिन भर में, किसान खाता है एक बारी में. Look at his physique, look at my physique. So it is not what you eat alone. What you burn is equally important, possibly more important. So exercise makes you burn your calories, number one. Your muscles, they consume more glucose, what we call the disposal of glucose, right? So, of course, glucose is not garbage, but nonetheless, disposal. So that is how exercise works in a major manner. Now, exercise might not help you lose weight sometimes. There are so many people, but their sugars are better than the ones who don't exercise at the same weight and same physical activity. So exercise role cannot be negated at all. Weight loss or no weight loss. Exercise is beneficial for your heart, for your cholesterol, for your blood pressure, and of course, the flavor of today, which is sugar control. That is one. The second is the flip side. Exercise can push you into low sugars. Okay, so Dr. Prashant Nag, when can you have a shortage of money if you go out shopping? Number one, you spend more, which means exercise more than usual, or you take less money than exposed, which means less calorie intake. And the third most important, your pocket may be picked, which means that you've eaten well, but you vomit out. So hypoglycemia, three things you need to understand. So that is why someone going for an exercise with borderline sugars, we always say we must carry a can of juice or a banana or a sugar sachet. Sugar sachet and banana are the most beneficial. Juices sometimes might not, but yes, banana and sugar sachet you must always carry with you once you go for a heavy exercise or an unaccustomed exercise.
Okay, so exercise something is very good, but again, we have to understand that we are at a place where our sugar metabolism is not at the best of it. So we have to be aware of what you call as hypoglycemia, that is sugar getting lower. One has to be very careful of. Got it. As you have said about hypoglycemia, we like to know, as it is a daily disease, something one cannot run to a lab or a doctor day in and day out. We like to understand about self glucose monitoring, how one should take it, how often one should go for a self glucose monitoring. If you can throw some light out there.
No, this is very close to my heart. In fact, if you see my prescription, without fail, I write SMBG, self monitoring blood glucose. This is so important. And here I would highlight, one is the fasting sugar level, the other is postprandial. Now, unfortunately, postprandial has become synonymous with after breakfast, which is not the case. It is after breakfast, after lunch, after dinner. All are postprandials. Yeah. So, all are equally important. Yes, the heaviest meal is the most important. I personally attach most important to the after dinner sugars. And the reason is we come home from work, tired, have food, go to bed. Mind you, there is no after dinner walk, virtually non existent. And therefore, that is the time where sugars peak and it upsets your HbA1c, the 3 months average. So people are surprised, look here, fasting is okay, PP is okay. Why is this deranged? Because PP is not after breakfast alone. So self monitoring glucose is important. More so in gestational diabetes because there, as I said, 2 lives at our stake. Now, there's something called a continuous glucose monitoring. Now, that obviates the pinpricks that happen all the time. Insulin injections are not painful because subcutaneous, but sugar checking is painful, and I know that. So, here you could put a pin here, and there's a sensor which actually senses sugars all the time. So, you don't need to prick yourself, and therefore it is very important. The other thing is something called glycemic variability. Sugars up, down, they are very detrimental. So just to tell the viewers in general, 2 sets of patients, similar HbA1c, one has fluctuating sugars and one has nearly similar sugars. The one with fluctuating ones is more likely to have complications despite same HbA1c. So SMBG is an integral part of diabetes management. Also, you are taking sugars day in and day out. You are taking medicine day in and day out. So how do you monitor the effect of medicines? Every 3 months, HbA1c? That's inadequate. So SMBG is paramount.
Great topic to know. So, what is most important is that you have to see how your body is reacting to the food and the drugs. It cannot be simply the same for everyone. The stage of diabetes may look similar on the basis of your HbA1c value, that is the glycemic index. Uh, just for the viewers, as we haven't covered HbA1c up till now, I'll just like to tell that HbA1c is an uh, parameter which we measure where hemoglobin reacts with glucose, and because of RBC half-life is 120 days, so it gives you an average sugar for last 3 months. So uh, as you have said that if you get an SMBG variations for a same patient with having HbA1c same, and but SMBG is showing different variations, so will there be pharmaceutical things which you have to look for, or it is the dietary management you will go for?
So first of all, dietary, and I will mention a few cuisines, and please don't take it personally. But the best is breakfast. In what regard? See, in lunch or dinner, we have similar food every day. I'm not saying lunch and dinner are the same. What I'm saying is that lunch on day A and day B are almost similar. A sabzi, some dal, some dahi, yogurt, and of course chapatis or rice as the case may be. By the way, rice is allowed in diabetes. Small amount of rice you can have in diabetes. Same with dinner. It's the breakfast where the variety changes. Now, every body is a different individual. Metabolism is different. So, there are people who may have high sugars with chapatis, not with rice, and vice versa. So, breakfast you need to figure out what is that which causes high sugars, whether it is rava idli, whether it is paratha, whether it is stuffed roti, and avoid that totally. Paratha obviously has certain reflex. Deep fried parathas obviously are not on in diabetes, but obviously stuffed roti may cause high sugars. idli might not. Vice versa may be true. So that the patient needs to figure out, and there SMBG assumes lots of importance about what to eat and when to eat.
So moving on from this glucose monitoring, and we covered one complication, that is hypoglycemia. We'll like to understand more about, as we know that diabetes is labeled as a slow killer, and it affects many organs, it affects nerves, it affects kidneys, it affects eyes. So we'd like to understand what all complications and how the sequencing of complications happen, and how one can be more careful about it.
Now, here I would wish to tell you that sugar control is important, but not the only important thing. Blood pressure control, lipid control, cessation of smoking is probably more important, if not equally important, as compared to glucose control. The complications can affect the kidney, the eyes, the nerves, the heart, and the stroke, and now possibly liver is emerging in some kind of a way as regards complications are concerned. Of these, cardiac events or the heart problems are most common killers in diabetes. As I said, they occur a decade earlier in the Indian populace as compared to the Westerners. Kidney complications are the most expensive ones to manage because of dialysis or possibly transplant. Neuropathy, nerve, is the most troublesome. People can't sleep at night because of burning, tingling.
So can you go bit detail on diabetic foot, because that is something which users must have heard, and they might be interested in knowing about foot care and all about diabetic foot.
So again, diabetic foot is so important. And mind you, diabetic foot is the second most common cause of amputation, only after road accidents. So they are the commonest. This is the
So
second
when we
commonest.
say amputation, it is about
Removal of
that.
a part of the foot, or even below knee or a big toe or the toes. So diabetic foot can happen either the nerves are involved or the blood supply to the foot is inadequate. I'll tell you something, that heart is the center, right? So imagine a huge quadrangle, and as you go into the bilanes, what happens is that the congestion increases. So in the whole quadrangle, maybe 6 or 7 cars would cause a traffic jam. There, only a single car can cause a traffic jam, right? So now the farther away from the heart, the narrower the vessels, and any clot which gets impacted there, or any foot infection which causes swelling, and the swelling compresses the foot or the vessel from outside. So, and already the blood supply is compromised. On top of that, we have swelling, the blood vessels are compromised, and gangrene, which is not the dead, but then gangrene means that there's no blood supply and might not be salvageable. So that sets in. So diabetic foot, neurological and ischemic, which means nerve sensation decreased and lack of blood supply.
So a simple diabetes, a simple poorer control of sugar may lead to loss of a limb or a part of a limb. Really sad, and one has to be active about it.
So
And
again, foot care is written on all my prescriptions.
we'd like to know more about what all new technology is coming, like how insulin pump is working, how it is helping, say, a type 1 diabetes patient. So if you can throw some light out there.
So insulin pump basically is implanted on the abdomen, and the tube goes in and it secretes insulin in the subcutaneous area. Type 1 is the point you raised, and it's a very nice point. Why? Because type 2 diabetics have some amount of insulin in the body. Type 1 has virtually no insulin. So that's why sugars are so labile. So if there's something going continuously, obviously it will have a better impact than some things being given off and on, maybe 4 hours or before meals or bedtime. So obviously the CGMS, or the continuous monitoring, and the continuous pump, they would put sugars at a better level, particularly in type 1 diabetic, as compared to the ones who take insulin sub-Q 3 times a day, 4 times a day. So yes, that has revolutionized treatment to a major extent and delayed complications in type 1 diabetes.
Taking the treatment part bit deep, There are new drugs which are coming, which are lot talked about, like semaglutide and all. So if you can put some light over there also.
Semaglutide is the flavor of the season because it is causing weight loss.
Yeah.
You know what, Dr. Nag, what happens is that these drugs do work, but you also have to work hard upon it. It's like a child who says, भगवान इस बार पास करा दो, अगली बार पढ़ लूंगा, पढ़ेगा फिर भी नहीं, तो फिर फेल ही होगा. So semaglutide does work, but you have to have some effort. But here I would like to say that semaglutide is approved for weight loss in the US and abroad, but in India it is not approved for weight loss. It can be used in a diabetic patient. It will cause weight loss. That's a benefit which is an add-on. But in India, as of now, semaglutide, which is the oral variety, is available, not the injectable as we talk. Oral is available. Used in diabetes, good response in terms of weight loss, in terms of sugar control, in terms of delaying cardiac morbidity, heart morbidity. But for weight loss, prima facie, semaglutide, India, not approved.
Thanks a lot, Dr. Kapoor. Starting from definition of diabetes, running through complications, exercise, and everything, it must have been a real knowledge booster for all the viewers and listeners. We'll just like to have one more view as you deal with so many patients with a huge experience of 25 years. You interact with caregivers. You must have seen people with anxiety. So if you can tell some message to the caregivers of diabetes, specifically mothers of diabetic kids, so it will be great.
So, first of all, we tell our patients that diabetes is your companion. So, love your sugar levels and you shall be fine. Now, the companion should also manage diabetes. It's got to be bidirectional. If diabetes is your companion, then the companion should also help in diabetes management, right? So there are two aspects. Number one, if the companion is related, maybe a son or a sibling, he's at equal risk. So therefore, by not eating gulab jamun or a sweet dish, he's not obliging the patient only, he's obliging himself first. Then the most important is that the companion should also be aware of diabetes, particularly hypoglycemia. So maybe a week or 2 weeks or 3 weeks of lean sugar control might not damage things. But one hypoglycemia can be potentially disastrous, fatal. So he must be aware of the signs and symptoms and what to do. So tremors, palpitations, sweating, extreme hunger, and abnormal behavior, crying for no reason, laughing for no reason, it's not hilarious. This means your brain is not getting enough glucose. It doesn't know when to laugh, when to cry. That is important. So sugar monitoring and what to do, give juice, give glucose, give banana. Importantly, you should not waste time in making tea. You waste precious 10 minutes and obviously you can't gulp the whole tea. So whatever comes handy, just give it to the patient. So the attendant should be aware of this. And empathy. Don't sympathize with the patient. Feel in the same shoes.
Thanks a lot, Dr. Kapoor, to accept our invite on being a part of this series where we are talking about different diseases. Diabetes is what we are talking about today. With your 25 years of experience working in this field, I am very much sure that all the listeners and viewers will have great benefit.
Thank you so much for inviting me here. It's fine, 25 years, but I'm still learning.
Thanks, viewers and listeners, for being part of this podcast. I hope this knowledge on diabetes will be useful for you. Stay healthy, stay wise, till we at Tata Energy are bringing care to health.